My husband had a stroke. It all happened so suddenly and changed everything. I had 1,000 questions on my mind. Why him? Will he recover? How do we go on? They took good care of my husband in the hospital, but when he was sent home, we were left alone with our worries. Nothing was the same anymore, but I didn't know who to ask or where to get help. I feared that I had to stay home with him, and no one would help.
In Estonia, about 4,000 people have strokes every year. A stroke is a sudden and severe condition with serious and life-changing consequences for both the patients and their family. Approximately 20% of stroke patients die within a year after the stroke. 50% recover completely or sufficiently to cope with daily life, and 30% remain dependent on external care. In the stroke patient care pathway, a patient meets many parties, from the neurologist and rehabilitation specialists to primary care centres and social workers. Acute care provided immediately after the stroke is effective, but the subsequent care pathway is fragmented and complex from the patient's perspective. The process includes many parties, often with poor cooperation or coordination between them, which leaves the patient and their relatives confused and without necessary services. In 2019, the Estonian Health Insurance Fund started a stroke care pathway pilot project. The goal of the project is to improve stroke survivors' quality of life through more people-centred and integrated care. The project has 3 interlinked parts: care pathway development projects, measuring patient-reported outcomes, and a new payment model. The project includes 4 hospitals that in turn have engaged over 50 cooperation partners. The development projects test various innovative solutions on how to ensure the following outcomes. The patient and their relatives are provided with timely information they can understand and be involved as equal partners in decision-making. The parties to the care pathway agree on their roles, meaning who does what, where and how to facilitate the patient's transfer from one stage of the pathway to another. The patient has a comprehensive care plan that is available to all parties and accompanies the patient along the entire care pathway. The patient and their relatives have a coordinator to turn to for help and who guides them through the different stages. The patient receives services close to their home or at home based on their individual needs and preferences. For the first time in Estonia, patient-reported outcomes will be systematically measured. This helps understand a person's recovery resulting from the care process and what can be done to improve their quality of life. The new bundled payment model means that instead of paying for individual services, a single price is agreed for the entire care pathway. The idea is to stimulate cooperation and coordination between the different service providers to ensure that every stroke patient receives the services they need. The new solutions are being piloted until 2023. If successful, they will be applied nationwide in the future.
Patients and their loved ones shouldn't desperately seek for help and worry so much alone. The Stroke Care Pathway Project seems to be exactly what could help people like us in the future.
Visit the Estonian Health Insurance Fund's website to find out more about the pilot, an integrated care pathway for better quality of life.